As you know, the American healthcare system is notoriously inefficient. The Institute of Medicine a few years ago concluded that almost 1/3 of what we spend basically does nothing to improve people's health. And so what that tells us is that there's a tremendous amount of potential for greater efficiency in healthcare. And the purpose of the Arkansas Payment Improvement Initiative is to transform the wasteful way that medicine is practiced by transforming the way that healthcare is paid for.
The United States health insurance system leads the world in being employer-based. Most of the people who are covered in this country are covered through employer-provided health benefits insurance. And as I said, it's a voluntary system, at least up until the ACA, not mandatory. But now as the ACA is being rolled out and implemented, assuming it continues to be implemented, we're in a critical transitional stage, and the question is, what are employers going to do?
I think employers believe the healthcare system needs integration. It needs collaboration. It needs integration of data. It needs clinical integration. It needs common messaging and communication to deal with the health literacy issue, the benefits literacy issue, help giving people the skills and knowledge. But the business community itself is not going out and building ACOs. And frankly, what I'm seeing is hospitals just putting an ACO name on the plaque in the front and really not having the kind of integration, collaborative, cooperative care that you really need to make it happen.
To expand coverage in Arkansas to low-income people, our program had to be different. It needed a label and a pitch and a concept that differentiated it from what all the blue states were doing. The label, the private option. Private, not governmental. Option, not a mandate. The pitch, better health for the 250,000 Arkansans who lacked coverage, funded almost entirely by the federal government, with federal money, bringing in relatively high-paying healthcare jobs into the state with a ripple effect that lifts the whole state economy. Cost savings through more widespread preventive care and fewer ER visits, and in essence, having our broadened coverage subsidized by the taxpayers of states that were rejecting the Medicaid expansion. More than 210,000 previously uninsured Arkansans have enrolled in the private option or the expanded traditional Medicaid program. It's been good financially for the healthcare industry as well. The insurers, obviously, they get a lot of customers. The hospitals are benefiting. The number of patients is up, but their write-offs for care, for unreimbursed care for the uninsured, plummeted by 56%.
After more than half a century of U.S. policy that's based on it being regarded as the employer's role to provide health insurance, or the health insurance framework for the country, what will employers do now that their employees can look to the Affordable Care Act's exchanges, government subsidies, and guarantees of access to insurance? Do employers really need any longer to be the providers of health care, and do they want to do it, and what will they do? Practical considerations will affect this, and politics. Practical factors, what's going to happen to premiums? Will government support of the ACA continue? At this point, a lot of employees, if they're dumped into the exchanges, will get government subsidies. What if they don't? What if the Supreme Court decides they can't get the government subsidies? If the employers push more of the cost on the employees, at what point will the employees decide that they're better off on the exchange and start clamoring for it? Or if the employer is about to bail on providing coverage, when did the employees decide to push back?
If the subsidies disappear, that will undermine the whole risk pool, because that's what's attracting young, low-risk people to participate in health care. And during the discussions of the ACA, the insurance industry essentially wanted a bargain. We'll accept the plan as long as everybody's covered. Well, if everybody's not covered and there are no subsidies, all of a sudden now we have exchanges filled with higher-cost people, higher risk, chronic disease people, and we'll end up getting, the insurance rates will go double and triple digits.
A nervousness that we have is the growth of corporate medicine. A lot more mergers are happening. A lot of smaller providers are being put out of business. But there's a movement to help coordinate the care, whether it's the growth of ACOs or a variety of other things that are happening.
Join me in thanking our panel for a really interesting discussion.